And again, thank you, Amy. And again, thanks everyone for joining us for our summer learning series and today's program featuring the Early Childhood Alliance in Onondaga County. I'm delighted to introduce today's team captain and team captain of the ECA, Bethany Kreeser, who is their executive director and has a wonderful history of working in Onondaga County and in central New York, really demonstrating tremendous leadership and connection, particularly for so many children and families within Onondaga County. And overseeing the ECA, I'm sure is a great joy in, in her tenure of being able to support their policy initiatives, engage in state and national policy conversations, and being able to facilitate and drive a fantastic network of providers and parents and professionals that are dedicated to making change and lasting positive outcomes for young children. So with that, I could go on, but I'm going to just, I don't want to delay, and I'm going to welcome Bethany and to come off mute and her team to share the slides. And if everyone could, who is attending could go off their camera. If you could stop your video, make sure you're muted, and I can guarantee that we are going to share the recording, we'll share the slides, and also the contact information for today's presenters. So with that, Bethany, take it away and welcome and thank you.
Thank you so much, Rachel, for that really warm welcome. And we are really, really excited to be here today. I am here with 4 out of 6 of our ECA Onondaga leadership team. And it is wonderful to see so many friendly faces from partners from across the state. I feel right at home here with many of you all. So we're going to jump in. I will say that we're going to give you a lot of information. I'm going to introduce each member of our leadership team as we go. And if you have questions as we go, please feel free to put those in the chat, and we're going to leave some room at the end for questions at the end. So bear with us as we jump in and throw a ton of information at you, but thank you for having us. We're excited to be here today. So again, we're here to kind of talk about the Early Childhood Alliance Onondaga. It was created back in 2015, and ultimately the reason the ECA was created was to make sure that all children in Onondaga County are healthy, thriving, successful in school and life, and that all families of young children are supported in their parenting, that they have the knowledge, skills, confidence, and resources they need to raise their children in healthy and nurturing environments. The ECA Onondaga would not exist without our valuable partners. We have over 200 cross-sector partners, stakeholders from all areas of our early childhood system here in Onondaga County that are committed to making sure that our children and families are healthy and thriving. Next slide, please. To give a little bit of the history. So again, we were created in 2015, but the reason we were created in 2013, a group of our local leaders and some funders came together to take a really deep dive look at what the state of early childhood looked like here in Onondaga County. They interviewed all sectors of the early childhood system and did a really intensive deep dive, and the 2013 Onondaga Citizens League report was released. As a result of that report, we realized that we needed to do we needed to do a much better job of supporting parents so that they have everything they need to be able to support their children in being successful and being ready for school and ready for life. Next slide, please. This slide really kind of shows a nice picture and representation of all the different partners we have that come to the table with us to help us come up with solutions on how to strengthen our early childhood system. We have our home visiting partners, Head Start and Early Head Start, early intervention, preschool, and special education, We have our UPK partners, our childcare and early learning, our pediatric partners, and a really important piece of the work are our parents. The family voice and our parents are true partners in the work that we do here at the ECA. Next slide. I'm gonna now quickly introduce Carrie Wenham is our director of operations and data and operations, and she's going to talk a little bit why the data is important and how it informs everything that we do in Onondaga County. Go ahead, Carrie.
Thanks, Bethany. So happy to be here with everybody. Just some brief data points that kind of brought us to where we are. There are just over 30,000 children under the age of 5 in Oswego County as of 2020. Just over 11,000 of those children reside in the city of Syracuse. 1 in 5 children in Onondaga County live in poverty, and about half of those children alone live in the city of Syracuse. Onondaga County does not currently have a unified kindergarten entrance exam. The only comprehensive data that we have to date is the 3rd grade ELA standardized testing, which shows that across the state, only 52% of children are meeting those requirements, those ELA standards. In Onondaga County alone, 40% of the children are meeting those ELA standards. And in the city of Syracuse, only 22% of those kiddos are meeting those minimum standards. Next slide, please. This chart is representative up to 2019. We are currently working on collecting and improving and updating our data to represent what happened after COVID. But this is just a nice chart to show you that for cities of our size, Syracuse ranks 5th amongst children living in poverty. That is compared to, look over at Buffalo, they are currently ranked 14, Rochester's ranked 43rd, and Albany's ranked 92. So it's very clear that it shows that Syracuse has a significant need. And Bethany, thank you. I'm going to pass it back to you. You're muted.
Thank you. As we mentioned, the ECA was created in 2015, and over the course of several years, we have added some strategic initiative areas that really represents the work of the ECA. This is a nice visual representation of each of kind of the work groups in the strategic initiative areas with their own individual focus areas that ultimately equals hopefully kindergarten readiness for all our kiddos here in Onondaga County. We have a reproductive well-being work group, family well-being work group, early brain development work. We have developmental screening and supports, childcare and early learning infrastructure, and family voice as its own strategic initiative area as well. Next slide. So I am going to introduce myself now as I'm representing our Director of Family Voice, who's unable to be with us today. Saisha Bird oversees all of our Family Voice work. And I think it's just important to note, and I've said it a few times now, that nothing we do is without input from the families and the parents that we work with. We offer a variety of ways that parents can be involved and help co-create and inform the work we do, from broad engagement, just attending events, activities, helping us spread our shared messages, all the way to having parents as true partners in this work with us. We have a parent advisory council that we kind of run everything through and by. Anything that we're working on in our community, we work with our parent advisory council on. And I'm really happy to report that 2 of our original Parent Advisory Council members are now currently employed by the ECA, and they are part-time family resource specialists working with our Help Me Grow team. So really proud of that, and it's work that we want to continue to make sure that parents and families are at the table with us. Next, please, or next slide. Now I'm going to introduce our Director of Childcare and Early Learning is Megan Wagner Flynn. She is also pinch hitting for our Director of Family Wellbeing, who is Brandy Me. So Megan's going to talk a little bit about our family wellbeing work. Thanks, Megan.
Yeah, thank you, Bethany. So family well-being is really focusing on the well-being and overall support of the family unit. Think about pregnant and parenting families in our community. It's really important that we offer them wraparound support and make sure that our system is working together collaboratively to support these families. The way that we do that work is through starting first with family voice, as Bethany just talked about. Family voice is at the center of everything we do. We want to make sure that our parents are being heard and informing the system that's impacting their lives. And these are some of the ways in which we do that through focus groups and having parent partners whose job is really to work with parents and understand what they're going through and support them in their journey through parent advisory councils and family advisory councils, both at the ECA and supporting standing up those kind of councils in our community partners. Then targeted engagement, working directly with support agencies to make sure they have their needs met, making sure that the professional development for folks who are working directly with families in our communities is similar and streamlined across the board. All of that impacts our system design. So what are we testing and innovating? How are we using both qualitative and quantitative data to make sure that our system is informed and that our partners are informed and talking to each other about the ways that they're supporting these families, doing some gap analysis and monitoring the landscape. And then all of that culminates in kind of these connecting of the dots, where we have specific initiatives that come out of this process, such as working on a Strong Starts Courts initiative, potentially bringing a crisis nursery to Central New York. I know, especially in Rochester, you guys have 2 crisis nurseries. We're jealous, we need one ourselves. And then also working on building the relationship between our pediatric offices and parents, because we know that's where so much of this happens for our families in our community. And I'm going to hand it off to Summer, our Director of Help Me Grow Onondaga.
Good morning, everyone. Thank you for having me here. So within the Early Childhood System, Early Childhood Alliance, Help Me Grow actually serves as our system change model for here in Onondaga County. And it's really crucial to the work that we do. We really try to use the 4 little gears that are spinning right now. So we have our central access point, a central access point, which is our 211 call line. Then we have our family and community outreach, and that's really when we're engaging with the community in a variety of ways. The 3rd little gear is our child health provider outreach. That's truly the work that we do with our local pediatric offices. And what we do with all that, it really relates to the 4th gear, which is our data collection and analysis, is where we take all that data, we look at the results we're getting, we get our feedback from our parents, our community, and we really give that information back to the early childhood system, which is the ECA, to really figure out what changes need to be made here in Onondaga County, and how do we really use the data to make some of those changes happen. And so some of the things that we kind of have come up with here in our county, which have been really pivotal to the work, through the child health provider outreach, we recently formed a partnership. It started about two years ago with it's Upstate Pediatric Adolescent Center, also known as UPAC. So we actually host their residents. We currently have 16 that we work with throughout the whole year. So they start in July and they end right at June. And so through that time, we actually are their introduction to the early childhood system for some of them. And it's a really great way to show how the work we do and the work that they're going to be doing as pediatricians all kind of links together. One other thing that we do a lot of community outreach to our local pediatric offices to engage with them, because we know that one place children will go are to their doctor's office. And so as you can see with the referral numbers there, you can see how many referrals we had from our original start time in 2019 up to 2023. We had 858. And then we also wanted to show what we've been working on just right now for this current year. And we're at 164. So we're always kind of growing and doing that pediatric outreach. When we talk about our central access point, one of the easiest ways for families to reach us is by calling 211. And as you can see here, our numbers continue to grow as the need in our community grow and as our awareness grow. So in 2020, from 2019 to 2023, we had 688 calls, and yet alone just for the year 2024, we're already at 230. So we're hoping we might exceed that goal this year. And it's really a kudos to all the work that we do and how it works in our community. For our family and community outreach, one of the biggest things that we do is we actually survey our parents to figure out how is the work that we're doing here at Help Me Grow really changing their knowledge and the way that they engage with their own children. And so from our follow-up survey, it shows that we have 80.78% of respondents say that they've actually changed and done something different with their children, which is always great to see because we want to know that we're impacting the children. And then our last piece, some of the things that when we bring our work through data collection, you want to kind of have these innovative things. And we've been really grateful for some of our own community partners here. So as you can see, I listed DoorDash. That's a unique service we have through the United Way and their Ride United program. So in 2023, we had 668 deliveries, and this is really basic need items that we can utilize DoorDash to. We know that transportation is an issue, but we're able to get families things that they need at free cost to them. We had 668 for all of 2023, and yet from January to June, we are already at 716. So we are sipping up those DoorDash orders rather quickly, but it's really good to see that it goes right directly to the parents. One other thing that we utilize with our data is we were able to communicate with the CNY Diaper Bank, so Central New York Diaper Bank, to really show them that there's a need in our community in two strategic areas, Baldwinsville and Liverpool, to open up 2 new diaper banks. And so for the rest of 2024, they'll be able to service 200 babies a month, which will be 2,400 babies that will have access to free diapers. And what we're currently working on now to help with the transportation issue is, again, through the United Way, we'll be using their Lyft program. So we'll be able to give parents access to services that they need that might have a transportation delay in utilizing Lyft. So thank you so much. And now I get to, one last little slide there. So based on the surveys that we sent out, parents are always giving us great feedback. So I just wanted to highlight one of the things that parents say. These are great quotes that parents just leave in their surveys. So it says, I'm asking my child more questions and teaching him things I wasn't sure he would be able to retain right now. I forget they're little sponges. And so we always love to see how parents are utilizing the ages and stages materials that we provide with them. And now I get to turn it over to our Director of Communications and Operations, Emily Dillon.
Thank you, Summer, and good afternoon, everyone. Thank you for joining us. I am here this afternoon to introduce our Talking is Teaching, Talk, Read, Sing campaign. Talking is Teaching, for those of you who don't know, is a public awareness and action campaign developed by Too Small to Fail. We brought the campaign here to Onondaga County in 2017. And basically, it works to empower parents and caregivers to recognize their power as their children's first and most important teachers, and their power and ability at that point to help grow their children's brain with simple everyday actions, obviously talking, reading, and singing. And the whole goal of the entire campaign is just to make sure that our children have access to literacy-rich environments and are ready to enter school, ready to learn. Our campaign locally has 3 core components: our messaging campaign, our tote bag delivery, and our pediatric practice outreach. So from our messaging campaign, that's really just anything and everything that we're doing to try to get the talk, read, sing message out to families. The more words they hear, the more words they learn. Every time you talk, read, and sing with your child, you're building their brain and preparing them for school. Coming up next month, we have our 4th annual Feel the Beat Family Fest. A lot of the work that we do locally tends to focus on the talking and the reading. So this is really our opportunity to push home the importance of music in early childhood. Historically, we've had about 150 to 200 attendees, and we are partnering with our local mall this year, actually. So we're hoping to push that number up a little bit. We have a children's artist from Texas who will be joining us again this year, Andy Rue, if anyone wants to look him up. We are very excited. Locally, we also have an amazing television program that is on our local public access television station called Reading Buddies, in partnership with the Reading League. That is a great program. I'm going to plug my colleague Summer here. Her son is actually in it. So if anyone wants to check it out, they can see her son. And that show, I believe, has been on, I think it's in its second or third season now. And we sponsor it in 6 months increments, and we get about 500,000 impressions from that. For general community outreach, that's just community tabling events that we're attending. And you'll see in Q1 and Q2, we attended 42 separate events and sent that message to approximately 988 individuals. And then again, coming up this summer, we will have our transit campaign. We usually do 1 or 2 large media campaigns a year. This year, we're focusing on the summer so that we can capitalize on the state fair here in Syracuse. We will have billboards and what they call bus tails, which are just advertisements that cover the back of our Centro buses. And we're estimating about 2 million impressions for that. One of the biggest portions of what we do is train our home visitors as trusted messengers of the campaign. So they go through a training that actually also covers our family engagement work, really teaches them how to engage families and build trust with them so that they can then deliver the talking is teaching message and the importance of talking and reading and singing every day. In Q1 and Q2, we delivered through our home visitors 496 tote bags. And then, as Summer alluded to earlier, we know that if parents are going to take their children anywhere, it's going to be to their well child visits. So we also partner with our pediatric practices, specifically Syracuse Community Health Center, to deliver the tote bags at those well child visits. And in Q1 and Q2, we had 350 delivered. And I am just going to plug 2 things that I didn't put on the slide here that we are particularly excited about. As we have alluded to throughout the entire presentation, we try to engage and center our parents in everything that we do. And I am currently working with one of the members of our Parent Advisory Council on a children's book focused on the seasons of Syracuse and all the great things that there are to do in and around our community. We are co-writing that, co-illustrating that. It's really a great opportunity. And I am very excited to say that hopefully that will come out by the end of the year. And then we also are working with a local funder, hopefully, knock on wood, to implement some talking is teaching reading corners in local laundromats. So that is also on the horizon. Keep your ears open for that. And now it is my pleasure to transfer things over to Megan Wagner-Flynn again. She is our Director of Early Learning Strategy.
Thanks, Emily. I'm back. So one of the last things that we focus on here at the Early Childhood Alliance is childcare and early learning, particularly from a strategy and community infrastructure enhancement perspective. So as I know everybody on this call is aware, but so much of what happens in childcare is set at the state and federal level. And so the work that we do here is bi-directional. On the one hand, we're kind of trying to push up and help our state and federal government understand what it's like to be in childcare and what the challenges are for childcare providers and families here on the ground. And then also taking a look at our local community ecosystem to say, what are the levers that we can pull locally? We can't fix the entire childcare system at a local level, but there's a lot that we can do to improve the accessibility, affordability, and quality of care for families in our community, and then also the quality of life and support for providers in our community because they're doing such important work. So the process by which we kind of think about this work and use this work is really replicated all across our areas at the Early Childhood Alliance, but it starts with landscape monitoring and gap analysis and strategy design. So that's doing a lot of local research and putting out reports when we see fit, partnering with researchers to kind of understand where are we as a community, where are the gaps, what are we seeing, and then how can we try and meet the need in our local community when we have identified gaps. That really moves us into strategy implementation and coordination of services. So we've got some interesting local innovative projects like the Child Care Quality Improvement Initiative. That's a $1 million initiative that our county executive has really championed and supports, that brings high quality curricula and support and coaching to child care providers, particularly providers who are caring for children receiving child care assistance. So our highest need families in our community. That also looks like making sure that whatever is happening in our community as it pertains to childcare is well informed and well coordinated. So I know everybody's aware that Micron is coming to Central New York, and how are we working with our local ecosystem as well as new players like Micron to make sure that their strategy is informed and has kind of local context baked into everything that they're doing. Another way that we kind of make sure this work happens is through leadership development. Just like we do with our parents, we do not do anything in childcare without talking to our childcare providers first. These are the folks who are living and breathing this work, and we want to make sure that they not only have a seat at our table, but at all the other tables in which childcare is being talked about. We do that through, in particular, having a home-based provider steering committee, with the understanding that our home-based childcare providers are often left out of conversations. And this work is supported through Homegrown, which is a national funding collaborative focused on home-based childcare. One of the things that we've done through that work is to bring in Leading for Change, which is a leadership development cohort course for childcare providers specifically. What we heard from our providers was that they wanted to be involved in discussions and kind of policy and advocacy and changes, but they didn't feel like they had the knowledge and content expertise to show up well at those tables. So we brought in a course that helped providers build on their own existing leadership skills and get ready to participate in, for example, our policy and advocacy work. So whether that's going to Albany for the Empire State Campaign for Childcare's Child Advocacy Day, or whether that's meeting with local legislators or informing the work that happens and the investments that are made at our county level, our childcare providers' voices are baked into all of that work. And then last, and perhaps most importantly, we do a lot of community and stakeholder education. Childcare is a complicated system. The way that childcare is funded is complicated. And in particular, for our economic development and workforce development champions, we have a deep understanding of how important childcare is, both with its own workforce needs, as well as being a community support and the backbone that lets parents go to work. But helping our local economic development champions understand what the world of childcare looks like and how do you make investments and kind of work with employers and providers to build a system of support that gets families the care that they need and gets providers the rates that they deserve. And I'm going to hand it back over to Bethany.
Thank you, Megan. I think we, well, and you know what, Emily, if you don't mind going back to the rest of the quotes from Help Me Grow. I know we were like, oh, just read one quote, because we didn't want to, we wanted to make sure that we had enough time to kind of get through all the content, and we did kind of throw a lot of information at you all, but I know Summer read the top one. I'm gonna read them all, because again, parent voice is a good place to end, just like provider voice. The information sheets that are offered after each screening are full of tips and activities to help improve your baby's development. I've used many of these when playing with my baby. I love this third one. I don't know why, because a lot of parents just use Google. Google is their go-to if you have a question. We used to use Google to Google the milestones that are expected of a child at each stage. But now we've adjusted ourselves based on the ages and stages questionnaire and started seeing progress in our child's development. So Help Me Grow Onondaga uses the ages and stages questionnaire as the check-in, as the tool for parents to have a better understanding of their child's development and to continue to keep a pulse and monitor how they're doing. For parents to know that the ages and stages questionnaire, or Help Me Grow, is their new Google, I think is one of the best compliments. And I have learned new and different ways of play that teach my child skills to help strengthen his development. So I just thank you, Emily. I wanted to go back to those because we were rushing, but I think it captures really nicely from the parents and the fact that Help Me Grow is our systems building model that we use here in Onondaga County. It kind of brings us full circle on how this work works and how it directly benefits the parents that we're working to support. So you can go back to the thank you slide or the very last slide. The other thing I wanted to mention early on, and I didn't, is funding, because I know that that's a really important thing. Megan mentioned how the county executive has invested over $1 million in the child care quality improvement work in our child care and early learning strategy. We are very, very blessed to work with both our public and private funding. We've worked hard to intentionally braid and blend those funds together to sustain and support all of the work and all of the strategic initiative areas here at the ECA in Onondaga County. So I know funding is usually a question folks ask, but I wanted to make sure I mentioned that as well. And at any time, again, I think we are ending a little early, but I want to leave room for questions at any time, even if folks have questions who are watching the recorded session later. You can reach out to myself or any of the members on our leadership team here with any questions. If you wanted more information, we are happy to work with folks. I am going to just say you can take the slide off because I kind of want to see people's faces instead of my own face. Thank you. I see our friends in Oswego County who are right to the north of us in Onondaga. And they are our newest Help Me Grow partner here in New York State. And I say partner in the truest sense of the word, but we literally, we view our Help Me Grow Oswego folks like our I want to say our little sister to the north, and we're sharing everything we have, including our data system, all lessons learned. When it comes to coalition building and systems building, we are all in this together, and to share lessons learned. And if we could have an early childhood alliance in every county and Help Me Grow New York State, I think that is a dream and an end goal for us here. I don't want to speak for everybody, but I see a lot of our friends at the table. We are happy to share, any information we have, because we are all in this together. The collective we need to do a better job for supporting our family, our parents, with our giving every little kiddo the best start possible. So with that, I'd like to open the door for questions.
Awesome. Bethany and the entire team. Thank you. I'm giving applause. That was a fantastic presentation. And you all are doing such incredible and impactful work that's innovative and inclusive. And I'm just so happy that we were able to hear from you today. I'm going to I'll invite anyone who's on the call to either drop a question in the chat or raise your hand. And if folks need a little bit extra time, I have a whole host of things I want to ask. I've got like pages of questions, but I want to make sure that I give those that are attending today the first opportunity to raise a hand or pop a question in the chat. So I'll just give a few moments to see if anything comes up. And then if not, I've got pages, like I said. Okay. Hearing none at this moment, I'm going to start at the top, just kind of the sequence of your slides. So I think the one thing that I made note of, and also just kind of following your journey and engagement around screening, and Carrie mentioned it just with a kind of data dive on the kindergarten and pre-kindergarten screening process, and that you all are engaging many districts across the county. Would love to hear a little bit more about that and just kind of the expansion and reach of trying to drive to some uniform or unified screening opportunities and assessment tools, because that is also a priority of Liftoff, of trying to have narrowed down the universe of assessment tools so that we have a better appreciation and understanding of how young children are doing prior to entering kindergarten, and especially how well they're entering 3- and 4-year-old pre-kindergarten. So I don't know who would like to start, but I'd invite you to share a little bit more about that process and just kind of how it's going and what does that look like.
Sure. I'm happy to jump in, and then Carrie and Summer can jump in as well. I will say we have kind of a timeline slide that we still need to update that literally kind of talks about all the initiatives. We weren't quite ready to share that, but it is important to note in our history that in 2023, May 1st last year, where the ECA had grown to be large enough and staff size enough to a point where we became our own non-for-profit. So our governance structure shifted, and our board of in growing our board of directors, we intentionally invited 3 superintendents from 3 of our largest school districts to join our board of directors. That has been one of the best decisions in terms of the ECA in the goal of advocating for a standardized, consistent kindergarten entry assessment tool. There's some good movement happening there. And I think without leadership at that kind of level, as much as we've talked about it since 2015, there has been zero movement in terms of that effort specific to standardized kindergarten entry assessment. Now, that being said, there's still a lot of work that needs to be done, but we have 3 of the largest districts agreeing on and looking at it's the speed dial 3 or speed dial 4. I'm not sure. I don't want to misspeak on the tool itself, but landing on a tool that we are going to try to advocate for all Onondaga County districts. At the same time, Summer and the Help Me Grow team, we have been meeting with all of the districts, the UPK sites, and Summer, I'm gonna just off the top of your head, I know we keep updating the map because literally we're adding 2 more districts by the end of the summer. How many districts are we up to working with where we're doing the ages and stages screening at the preschool level? Do you want to jump in?
Yes. So we currently are working with 8 school districts in our county, which I will say we really took our time doing this because we know we needed to figure out all the ins and outs on how to make it work, especially like with who's going to process the questionnaires, how do we deliver it. I will say I give kudos to Carrie and Emily because Emily really helps us create, she helped us create like a 1-slide letter. So we have an editable letter that we can kind of just send out to districts. Carrie's been really instrumental with working with each program within the districts to figure out what is their need. We actually borrowed, I believe, another Help Me Grow's implementation plan. Emily was quick enough to edit it for us so we can take those. So it's a labor of love. It is not us just doing it like individually. So we have 8 that we're currently working with, and it really came from the ECA's leadership team. Districts before were kind of hesitant, but then once one got on, another one got on. I have to give kudos to Maria Gill out. She's our SU Faces team, and she works with the CPSE coordinators because she allows us to go to her meetings and have a space in there. And what that has allowed is for districts to reach out to us, which has led to, I know Bethany said 2, but there's actually 3 new districts that we'll bring on by the end of August. And there only leaves 5 that are left that we are not currently working with. And it really has been like one district is like, why aren't we doing this? Let's do it. And I think it's kind of like nobody doesn't want to have their county not shaded on our map, which Emily updates all the time. We're always like, oh, there's another one. And so it's really just them all believing in the message that all kids, the more data that we have, the better work that we could be doing as a county and how we can support children here in Onondaga County. So it really goes back to like, it's a team effort here.
I believe you. Thank you, Summer. And yeah, that's the best kind of positive peer pressure, right? Let's everyone get on board. And I think that having the superintendents as part of your governance also helps to have some champions. And I know that Liftoff in Western New York have a lot to learn from you all. So I'm looking forward to continuing to watch your journey of engagement. And I know that as we endeavor to work across multiple counties in Western New York around some common assessments, that we'll have a lot to learn and steal and borrow from you all. So thank you for that. Summer, since we have you on the screen and I haven't seen anyone raise a hand or drop anything in the chat yet, you talked a little bit about, well, Bethany too, and Megan, just your connection with pediatricians and the pediatric community, both through Help Me Grow, but then pediatrics supporting parents. And I'm just wondering if you or any member of your awesome team want to chat a little bit more about what that looks like and the sort of journey, if you have a bright spot or kind of a golden nugget of engaging with pediatricians of how that connection has been made, because we have a wonderful pediatric community throughout Western New York and of course the state, but would just love to learn a little bit more about what that looks like and any sort of tools or tips you want to share around pediatric engagement?
Yeah, so I'll start it off and then I'll actually give it over to Carrie because she used to be our pediatric resource specialist. And I will say, if it wasn't for her, we probably wouldn't be in the position we are right now. Before we started, though, when we were working on our 3 models within Help Me Grow, we literally paused pediatric work because it was so essential to the work we were doing, but we didn't know how to tackle it. So before we even started working with pediatric offices, we did an 8-week learning community with them, and we picked our top 3 medical offices that are Medicaid recipients. And it was 8 weeks of us meeting once a week. They all agreed to it. We did provide lunch and we did have funding. We had private funding that helped us do these luncheons with them, but it was 2 hours every week where we gave them homework, where like, what questionnaire to use? How do we need to do this? What does our referral form look like? What do you want the facts to look like? How do we engage with you? It was amazing. So we were able to do that. We also hired a retired pediatrician who partnered with Carrie, and they had a full list of all the pediatric offices. And Carrie went out to every single one of them and said, what are you doing? And I will tell you 2 things that she did, which was instrumental. If you guys know me, you know I love food and desserts. And Carrie graciously allowed me to help her create this, but we did pop-ins. And so we had one event where we just wanted to pop in with popcorn, and Carrie literally worked with a local popcorn company. We bagged up small bags of popcorn with like little like thanks for popping in, and Emily created all our ads and everything that we could drop off. And Carrie hand delivered every single one of them to every pediatric office just to say hi. And then she did a follow-up with one of our local bakeries, Harrison Bakery, and delivered donuts to them. And then I'll turn over to Carrie to see how she did the work with them with the implementation plan.
Thanks, Summer. I love that you named me Carrie Lee. I think I actually want that name now. So thanks for that new idea. Yeah, engaging with pediatrics is just really, really tough because they're so busy. And so when you get in with them, you almost have to speak in their language in order to grab their attention. And I often found that when we were able to get into the door and have meetings with some pediatric partners, they really thought I was trying to sell them something and then would later bill them down the road. And I'm like, no, I promise you, all I'm trying to provide you with is a tool to embed into your pediatric office so that we can screen more children and detect their needs early, because that is key. Like Summer said, partnering with the retired pediatrician was really helpful and essential in kind of learning the pediatric lingo. What are words that they don't want to hear? What are words that turn them off from agencies and community partners? And how do you reach them? Do they want phone calls, emails? Do you just have to pop in on the fly and try to connect with them? One of the things we had the ability at one time to buy some swag items to kind of give to pediatric offices. This is one of my favorite ones. Summer and I were always kind of hitting our heads against the wall going, what do we buy for these pediatric offices to like give them and engage with them? So I said, well, let's just ask them what they want. And they wanted these scratch pad, mouse pad, scrap paper things. So we bought them. So when I go to pediatric offices, I love when I see these on their desk because it's a constant reminder of who we are, what we do, and that they can reach out to us to engage deeper. The popping into pediatrics with the popcorn was a huge success. They too love food, and I believe at that time I created all of these folders about what the ECA is, who Help Me Grow is, what we do, and what the ages and stages questionnaire is. And then the donut, I called it the donut drop. I think we did that in like January or December time. And it was really just a thank you for being an amazing provider to the children in our community, because they need you and they value you so much. So we haven't done that in a long time since I've taken this new role. I would love to, we've always kept talking about like, how do we get back into that to kind of get our name back out there to them. But we've been, when we were doing it, it was really successful.
And then I'll just follow up to the one part that you mentioned, Rachel, about our pediatric support and parents and our residents that we have. This also was kudos to Carrie. We had one resident, she was a 4th-year resident with UPAC. So our pediatric supporting parents grant that we currently have that Brandy's overseeing. It works with UPAC to really support, because it's a teaching hospital, we want to make sure that parents are getting the best response. But we also noticed that there's a lot that we can do from the parent perspective, but how do we do it from the pediatrics perspective? So Carrie actually, one resident shadowed with Carrie, but she was a 4th-year resident, and she gave us feedback and said, you know, as a 4th year, I'm kind of new and like I've already been here, done this. You need to switch the policy over to 1st-year residents. So they created, it's an advocacy course that they have to do, and it's through Help Me Grow. So it gives us a chance to really work with them one-on-one. We have 16 residents over the course of from July to June, like to the whole year. But what we realized is that some of them are so new to Onondaga County or even to this country, they have no concept of what early childhood system building looks like, feels like. So it's a nice chance to come into our office. Carrie and Brandy have worked to create like a check sheet, a checklist that they can select different things. Our directors are gracious enough to allow them to spend time with them because they get to check things that are of interest to them that's going to help build them up as a pediatrician. So that even if they don't stay here with us in Onondaga County, wherever they go, they can kind of find the same supports or look for them and know what it could look like wherever they end up. A lot of the residents have said they're from different countries. They're like, I want to take this back to my own country and build upon it. But it's also, I will say, we had 2 residents so far this year. One, this is her 1st week in the US, and she was like, what is this? What is early childhood system? I've never even been to America before. And we were like, oh, let's show you our community. Let's show you the support that you have. So when a parent comes in and they ask for something, you know what it looks like before just saying like, oh, connect them to WIC. We said WIC and she said, what is WIC? And we were like, oh, we have to go deeper. So Carrie's actually doing a tour tomorrow with our 2nd resident just to show them the county because she comes from Canada. She doesn't know Onondaga County. So that's been really instrumental. And then it builds off to pediatric supporting parents because we really want to make sure that when they're engaging with those parents, we're using the same language. They have the support that they need as pediatricians, and that it just continues to work all around.
Thank you both so much. That's fantastic. I've got a lot of good ideas jotted down. The popcorn, the donuts, the swag, all of the things, the mouse pads, the notation pads, and I appreciate Summer, you also anchoring it in the residency program and just the unique opportunity that that brings and that the sort of system building that that's all about, right? Of working within the program and the education of our future providers. So thank you for that. I'm going to see if there's anything in the chat. So we got a thumbs up and amazing from Kim Stewart of just the work that's happening. So thank you for that. I'm going to ask Bethany, just how you kind of close the presentation about the political will and championing that you have of a stellar county executive that's supporting the early childhood work and the Alliance. I'm wondering if you could share a little bit. We've got some funders on the call just to learn a little bit more about how the county is supporting your efforts. We've got, particularly in Western New York, some wonderful champions throughout in county government through county executives and other commissioners and legislatures, but just curious if you can tell us and shed a little bit more light on what that's looked like and how that's grown over the years. If you could talk a little bit about the political leadership in your county and how that's really helping to sustain and grow the work.
Yeah, I can't talk about the ECA and the work that we do without speaking extreme gratitude to the county exec and his support, because we would not be where we are or able to do so much of what we're able to do without that county funding and support. People are always like, how did you make that happen? How did you, and that was before my role as executive director. I don't get to take credit for that, but I do believe sometimes it's the right person and the right time. You know, when he was appointed into his role, he himself had small children in the early childhood system. So I know that's an important piece. It's got to be meaningful for the buy-in to be there. But then he's got, excuse me, his director, human, oh my goodness, Ann Rooney. His second in command for human resources. I'm going to get her title wrong. I apologize. She's amazing. Ann Rooney sits on our board of directors. We have, or not as a voting member, but as a consulting board member, and all of the commissioners, the commissioner of DCFS, the commissioner of the health department, and the commissioner of DSS all sit on our community advisory council. So we have representation from all levels of county leadership in our work groups as we are doing the landscape analysis, as we are identifying gaps and needs, and as we are working together to come up with solutions to help strengthen the system. You know, I wish there was a magic wand and a way to get all county executives to support their early childhood system work. Deputy County Executive, thank you, in Onondaga County. Thank you, Summer. So I have the correct title. And we are just so incredibly grateful for the support, the commitment, and listening to our county exec talk about investing, whether we're at a Central New York diaper bank walk and he gets up and he gets the importance and the connection. If you invest and you make sure a parent has diapers, they're more likely to hear and care. And if they have their basic needs met, they're able to hear and receive the important messages about how to support their child's development, and talking and reading and singing to them every day. And that will prepare them for school and for life. So, he spreads the message everywhere he goes as well, which is really important. I don't know how to get everybody else's county execs to buy in. I wish I
That's
had.
okay. Well, we have a lot of wonderful county executive champions through the Thruway Belt and across the state, but it's always lovely to have a champion that can also encourage and speak to their colleagues and peers across the state of what would could be a light lift or a heavy lift, right? What does that look like? And so appreciate hearing more about that, and also just the strong commitment and engagement of the multiple levels, right? Of really that interdepartmental work that's happening across the county. So that's really fantastic. I'm aware of the time that we have about 5 minutes left. I had one more question, and we could probably spend, I don't know, a few days talking about it, but I'm just going to ask Bethany and maybe Megan, when you were talking about the childcare and early learning work, your engagement with the business community, and the unique approaches that you're taking around community and stakeholder education. I'm not going to ask you to get into the weeds or talk about the amazing relationship that is growing with Micron and all of the important work that's happening. Buffalo, Rochester, Syracuse, we are, the tech hubs, and this is an area that Liftoff is going to with our partners and leaders dig into and spend some time around some solutions to this important work with our business community. But I'm just curious if you want to share a couple of insights or tidbits of how you're working with the business community, and maybe telling our audience maybe one bright spot of what that's looked like as we think about solutions, right?
Absolutely. So I think, I don't want to speak as the business community as a whole monolith, but I think it's important to note that childcare is complicated. And, so much of what we do is really helping to use the local data that we've collected, the reports that our researchers have written, or that we've partnered with our community partners on, to kind of constantly be using data to explain what our local landscape looks like. So for example, post-COVID, we did a supply and demand landscape analysis because anecdotally, we knew we did not have enough supply to meet demand by a long shot. But I think it's really important when you're talking to the business community, for example, and they're saying, my employees are struggling with childcare, and how do we fix that? To say, like, this is a community issue. This isn't something that any one particular business owner can solve. And so that really reframing all of this as a community approach and community support, and the understanding that when you support a childcare infrastructure on behalf of the whole community, you're benefiting your employees, you're benefiting yourself. So we've used data a lot to kind of like set the playing field and help people understand where we are, but also to understand what approaches are currently being invested in and currently working on a small scale and can be brought larger in our community. So for example, our partners at Peace Incorporated, they're a community action agency in Onondaga County. They had some Alliance for Economic Inclusion funding that built their Early Childhood Career Pathways program. And that's a program that really does workforce development for early childcare. And one whole leg of that program was helping interested individuals, almost entirely women and almost entirely women of color, open their own home-based childcare facility in their home. And that's a partnership between Childcare Solutions, our local CCNR, and Peace Incorporated. And so that's, for example, something that because we know what's going on in the community, we've got the data, we've got the partnerships with our community partners who are boots on the ground doing this work. That's something that we were able to bring forward to different businesses like Micron to say, hey, this is a place you could choose to invest if you so chose. And I think that it's been really nice that we have the relationships and we've got the support, but we've also got all the data to back it up to say, we can't necessarily fix all of childcare tomorrow with a large sum of money. I wish we could, but what can we do at a local level to improve our local ecosystem and really offering businesses places to invest? And then also things just as simple as we partnered with the Onondaga County to make a very plain English, what is the Child Care Assistance Program and how do you talk about that? This was prior to the Business Navigator toolkit that just came out, but really trying to say, hey, if you're an HR manager, for example, and you're sitting there talking to an employee and you want to talk to them about the Child Care Assistance Program, but you need to be able to answer some of their frequently asked questions in plain English, approved by the county, here's an example of what you can say so that you can have kind of a more direct level of communication and support somebody on an individual basis. So it's everything from like individual support all the way up to community system support and everything in between.
Amazing, wonderful examples. Megan, thank you. You are a force. And so honored to have you leading so much of this really important work in Onondaga County, given your expertise and reach and just understanding. So congratulations on all the work and to the entire team, right? For all the work that you've been doing. I am aware of time. We did it. We took the full hour, my friends. And so with that, I just want to say thank you to the entire team for all of the incredible work that you're doing, for showcasing and sharing your time with us today, and being a part of our summer learning series around early childhood alliances. And so such a wonderful time to be together. And thank you, thank you, thank you. And I just want to say thank you to all those that attended and that are viewing this potentially at a future time. And I will also extend Bethany's invitation with the slides and their contact information, that if you're viewing this at a future time or you're thinking about something, to please don't hesitate to reach out to the team, or you can reach out to me or Amy at Liftoff, and we can help navigate some of those important questions. And so again, thank you so much for all the work you're doing, and to the entire ECA team, to Emily, to Summer, Merrick, Carrie, Megan, and to the whole group, thank you, and Bethany especially. And with that, I'm going to bring us to a close and wish you all a wonderful day and a really great end to your summer season. So thank you so much, and we'll see you soon.
Thanks, Rachel.
Thank you.